Good evening. Good evening. What's going on, guys? Welcome to a late edition of Sunday Morning Transplant Coffee Talk. I am your host, Steve Belcher. Thanks for joining us. So yeah, I just got back this evening about 4:30. The flight landed, and it took about an hour just to get my baggage. Three flights landed at the same time, so I was unfortunate to be the flight that bags got unloaded last. So I was able to get back in time to definitely broadcast this show. I appreciate you guys waiting for this show. And for the ones who are not here tonight, you can always go back and look at the show. So let's get started. I'm really excited about our guest because the way I heard about our guest is through two brothers who took it upon themselves, Jared and Jeffrey Brown, to advocate for this lady for a kidney donor. And when I read her story and looked at it, I was really amazed on her tenacity and her fortitude and, keeping herself active and getting the word out and even um, advocating for a kidney donor. She's a two-time kidney recipient, going for a third time, a grandmother, a kidney warrior, been on dialysis for 8 years. She's from Pasco, Washington. So without further ado, let me bring on Jesus Mendoza. Hey, Miss Mendoza, how you doing?
Hi, Steve. How are you today?
Pretty good. How about yourself?
Here, just enjoying the cold weather.
Cold weather. Now, tell us about Pasco, Washington.
Well, Pasco, Washington is called the Tri-Cities because we have two little towns that are together. We have Pasco, Kennewick, and Richland, and they're in the
Hmm.
middle of Spokane and Seattle. 4 hours away from Seattle and 2 hours away from Spokane. So it's
Wow.
called the Tri-Cities. Yeah, but
Wow.
they're big.
So being way out west, because you're actually pretty much on the other side of the coast,
Yes.
um, are there a lot of dialysis units there as it is in a lot of the um, inner cities?
No, we have one here in Pasco. We have two in Kennewick,
Okay.
and one in Richland, but that's about it. Yeah,
Hmm. So how many chairs is the clinic that you go to?
there 12 shares,
Really?
12 shares, yeah, and a private room, yeah,
Are all those chairs filled up?
yeah, all of them, yeah.
What about all the other shifts?
They run. They start from 5 o'clock in the morning to 12 midnight, from Monday through Saturday. And there's
Uh,
some people that come a little bit out of the area, like from Sunnyside, and they kind of divide into the towns
so
that
they
are closer to them. Yeah.
so it sounds like they have four shifts.
Yeah. Mm-hmm.
Wow. Wow. So they
Yeah.
must be really running a tight operation.
Yeah. Monday, Wednesday, and Fridays are the main ones that are going all the full shifts, and then Wednesdays, Thursdays, Tuesdays, and Thursdays and Saturdays. I think they run until 7:30 until the last patient goes in.
Hmm.
Yeah. But they and
So,
Sundays they got off.
okay. So you've been on dialysis 8 years.
I've been 7 years in dialysis, and I had my last transplant lasted me 12 years.
Wow.
12 years,
So
yeah.
you've been dealing with this for a long time.
Yeah, I started in 1989. My cause was I was pregnant, and the doctor wanted to do a procedure, and I told him that how would I know that I would go into labor? He said, well, you have to have pains and stuff like that. But I went into an operation room with a friend of mine, and she had her baby at 9 months, but the baby was already dead inside. And I never thought about it, and I went with her because her husband didn't want to go in. But when she delivered the baby, the you could smell all the infection on the air, and I'm kind
Mm.
of guessing that I got it through there because a week later I got my baby died inside it, and I caught fever of 104. Yeah, and
Wow. Where was
that's
this
when
at?
I had. Yeah, and I went into. I delivered my baby, but then the doctor didn't do a DNC, and I went into septic shock, and then from there
Mm.
he transferred me. From there he transferred me to Spokane. Yeah,
Wow. Wow.
yeah,
So I'm sorry to hear that. Wow. Where was it? Wow.
yeah,
I gotta digest that for a moment.
yeah,
So you're saying that your friend that you went when she went to have her baby,
yeah,
when she delivered, you could smell the infection in the air.
yeah.
And,
Even if you
and
wear
you're
mask.
thinking and you're thinking that those fumes may have got inside your body
Yeah,
and caused kidney disease or caused you to go in a septic shock because your doctor didn't do a DNC.
yeah. Well, you could smell it, all the infection, and
Mm,
you're using masks and everything and gloves and everything, but apparently you still have to breathe it. So a week later, I got sick, and when I went to the hospital, they told me your baby's dead. Your baby's not alive. You know.
mm.
So
Wow,
I
I'm so
delivered the
sorry to hear
baby. Yeah, I delivered the baby and everything, but the doctor said that it was not necessary to do a DNC, and then from there, I just didn't know too much about what I was going because then I went into septic shock and I got transferred in the helicopter to Spokane. And to me, it was just everything so fast was going. And then from there, I didn't know nothing because I went into a coma for a
that.
little
Mm.
while. And then my
And that's when
parents,
your kidney shut down.
yeah, everything shut down for a while. But the ones that they couldn't recover were the kidneys. Yeah,
Mm. Wow,
yeah,
so sorry to hear that.
yes,
Wow. So it wasn't from diabetes or
no,
hypertension. It was some unfortunate incident
yes,
that happened.
yes. Mm-hmm. Yeah,
Wow.
because
And so from that point, you started dialysis?
I started dialysis, and then from there, I lasted. That was 1989. In 1992, I got a transplant, and it just went to 3 years. And then from there, I went back into dialysis, and um,
So let me ask you, I'm sorry to interrupt,
yeah,
but was your first transplant, was that from a living donor or that was from a recipient?
it was from a reception. The little boy, it was a little boy that drowned in Spokane. He was 10 years old and they donated his organs and I got one of his kidney. So I lasted 3 years with the kidney.
And what
The
happened? Did they
problem,
say why so of a short time since it came from a young boy?
the thing is that it makes a lot of sense when you get a kidney transplant. Um, if you don't, if sometimes you get stressed out and you don't know how to cope with it, and you start forgetting drinking pills on time, the same time, and stuff like that. And then your stress sometimes gets you on you.
Mm-hmm.
And at that time, I was going through, I, as a single mom, I was going through a lot of stuff.
Sure.
I had gotten out of a relationship, and then I went through an experience that every experience that I have had, I think is just a lesson to be learned, and
Absolutely.
we never finish learning until we die.
Yeah, that's
And
part of your journey.
yeah, when I came to Washington, I was running away from domestic violence,
Okay.
and in that period of time, I was experienced that they had molested one of my girls, and I was going through the stress. I was going as a single mom. I was working. I was trying to get into things, and I started rejection. So whatever you do, it affects your body. So I just went down, 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 and I just,
Mm.
sometimes
No,
we let the emotions go, and we don't know that the
right.
body resents it. I have learned that, and everybody learns a lot. Every day we learn stuff in life.
Oh, oh, Miss Mendoza, trust me, because I know throughout my 33 years in dialysis, I've known many people that,
Yeah.
transplant rejected that came back, whether it was 2 months, 3 years, or 15 years.
Yes.
Um, and I'm sure that's hard on the individual for one who may have had a transplant for 15, 18 years for a long period of time and it rejects, you
Yeah.
know, to maybe you having that short period of time and,
Yeah.
going through what you went through. But like you said, that's a learning experience and now you know.
Yeah.
So, wow. So that was the first one. So you went back on dialysis for how long?
I went for dialysis 1995. I lasted 4 years, and I got my transplant, the second one, on 1999 of July.
So
And
can I just ask you, can you just take us when you got that phone call? What was you doing when you received? Well, let's go back to the first transplant. What was you doing when you first got that call?
when I got the first phone call from my transplant, I was working, and then I got a call that I needed to go to Spokane, so I went to Spokane and got the thing. On my second transplant, it was weird because when they called me, I was working in the harvest of the potato, and we were putting in like 12 hours a day. So I would do in the breaks, I would do the PD exchange in my car. I would do it
Wow.
there, and I got a
Wait a
transplant.
minute.
I
Hold
got the
on. Hold
call.
on. Wait a minute.
Yeah,
Hold on. Stop right there. Wow. Because I commend you on that. Seriously.
yeah,
Wait a minute. So you was working
yes,
and you did PD inside your car during your break.
yes. During
Wow.
my last break, yeah,
Wow. I commend you on that. Seriously, because you have people who won't even do PD, let alone would go to the point of doing it in their car during their work break, and that's really something to be commended on your tenacity and your fortitude. Because I mean, we all know with kidney disease, some
yeah,
people, it takes them out of work because of their energy. Some people can't work, some people do, and it disrupts your lifestyle. And for you to implement and incorporate that into your work schedule so it can work for you, I really commend you on that. Seriously.
yeah. They call me, and my boss went into the line where I was having taking the potatoes from the belts and everything, and she told me, Jessica, you got a phone call, and you need to go to Spokane because you got a kidney transplant. And I said, okay.
Oh man.
So I left and I went to the office and I told the boss, I said, I'm leaving because the secretary called me, and he says, well, if you leave, you're gonna get fired. I said, no, I quit. I'm going. So
Oh
I
man,
left.
that just gave me goosebumps just hearing
Yeah.
that.
And I left, and when I got to the hospital, that they told me, okay, we're gonna give you a soap and a lotion or something like that, and they said you need to take a shower and put all that lotion on your body and everything, and just wait for us, and we'll take you to the thing. So I fell asleep. I was so tired that I fell asleep, and I woke up, but apparently it was already the next day. And I told the nurse, "Aren't they gonna take me to get the surgery?" And the lady says, "You already got the surgery." And I said, "What do you mean I got the surgery?" She says, "Well, the doctor saw you so peaceful asleep. He just put the gas mask and everything, we just, didn't want to wake you up.
Wow.
So to me, I didn't even know when I went to the
Wow.
surgery room or nothing because I was tired
Did
and
you
they
sign
knew
the
that I was
consent
working. Yeah, I did already had signed the consent
form?
form and
Okay.
everything, but I was just waiting for them to take me. But apparently, I fell asleep in bed,
Right.
so
Right.
the
Okay.
doctor knew that I was working and everything, so they didn't bother to wake me up. They just took me in. But to me, that one, I just know that I got to the hospital, took a shower, and the next day I was already awake, but I already had the transplant. So,
Wow.
you
God
know,
bless you. Wow.
yeah. But right now, I'm not working. I want to work, but I guess I'm not that young like before. But now I get exhausted sometimes from the dialysis. And I
Sure.
think it's
Sure.
just the age and everything, when 12 years ago I was a little bit more younger, my body could cope with more stuff and everything. But right now I like to work because I get desperate of not working. I could do
Mm-hmm.
small things, but usually
Mm-hmm.
most companies don't hire you because they said, oh, if you get sick and you go to the hospital, and stuff like that. So I haven't found a program to fit.
Mm-hmm.
Yeah.
Um. Wow.
Yeah.
What? How many hours a week?
I
I
do
mean, how
three
many
hours.
hours you do?
I do 3 hours a week. Um,
Mhm.
I won't go into 4 hours or three and a half. I go in through 3 hours, and the doctor sometimes has a hard problem that he says, Jessica, you need to increase your hour. I said, no, as long as my labs are going fine
Uh-huh.
and they're doing fine, I'm not going to 4 hours or 3 hours and a half.
Absolutely.
Yeah.
Absolutely.
So my work comes okay, my dialysis comes out clean and everything, so I don't worry about that much, too much of that.
Do you
But you
exercise?
no, I got a dog about two years ago, and he I just walk around here and stuff like that, around the house and stuff like that. But no, I haven't done exercise. My daughter tells me to go, but I just haven't
You
got to
should.
it. I don't like to go to the gym, but yeah, I need to get something done to go and do that, but I don't like to go. I don't have too much friends, so I don't know. Life has. I don't
Is
trust
there?
so much
Let me ask you
people.
this: is there a mall near you?
Yeah, about 10 minutes from here.
Yeah. Normally, like a mall where I'm at,
Uh
you
huh.
have people that go to the mall early in the morning before it opens and walk around the mall
Oh,
before a
okay.
lot of yeah before the stores open.
Oh, okay. I should do that. I
Hmm.
think one lady told me the same thing. She says you could go to the mall because some people go and walk on the mall. Yeah, I
Yeah,
have heard that
absolutely.
one too.
So let me ask you: you have a large family. You have 17 grandkids.
I got 17 grandkids.
Wow. So one may be asking, who's looking at this, um, why haven't you asked your daughter or your grandkids, have they stepped up to offer you a transplant?
My second daughter, did exams 3 years ago, and they told her that she had too much stress that she couldn't. And then my daughter-in-law 2 years ago tested. I took her for labs. I took her for an ultrasound. I went with her to test and everything, and then they said that she couldn't because she needed medical afterwards to go and do checkups. And we offered if we could buy the insurance, so she could take those visits and everything. And they told us no. And so now Lisa wants to donate, and I know that I racially said so. I'm the person that's in charge of her. But as respect, I totally said if your mom and your dad give you consent, you could donate with a signature and a court. But they told her no, that she had to be 18 years old to test.
Wow.
So
Oh, sorry. Sorry about that.
That's okay.
With with your first daughter, they told her she had too much stress. Was that through the psychiatric evaluation?
Yeah, well, the lady from the transplant, Nancy, told me that. So I don't know
Right,
how
but
they.
how would they determine if she had stress or not to donate to you? I never heard that before.
I have never heard that either, but they told me that. I don't know. I know you answer a lot of questions in your medical sheet, but I don't know if they base themselves on that or they just base themselves on a little bit of history that they have with me that apparently she's my problem child. She was my problem child, and until now she's just growing up. So I don't know if they base themselves on that
Right,
history. I don't
right.
know. Yeah.
Maybe some risk factors doing some questioning.
Yeah.
Um, okay, wow, wow. I mean, you would think, and just looking from the outside in, that by you having so many, people in your family, that you would think you could get a match and get a transplant from such a large family. But then when you share why and some of the reasons, it almost sounds almost absurd, because
Yeah.
these are your family members. It's not like it's somebody from the street or anything like that. These are your family members right there where you had the donors, but they have this little
Yeah.
cliche that won't let that happen. And that's just, I mean, it's
Yeah.
frustrating to me, and I'm sure it must be frustrating to you.
Yeah, because it's like it's not for nothing. Everybody has stress in their lives. It doesn't matter
Absolutely.
how small or nothing. Everybody goes through that. Even if you're married, you're a single father, a single mother. You go to stress. And life right now, as you see it, most of the grandparents are raising grandkids,
Mm-hmm.
and some stepdads are raising other kids from another relationship, and you look at the other ones, the real fathers raising another kids that are not theirs. So everybody got stress, if it's
Absolutely.
money or everything. So
I
I
got
think that,
stress right now.
yeah, I just say the way the person handles the stress, that's the main goal. Because I
Mm-hmm.
know it never, it's like some people tell me, Jessica, you have gone through a lot. You have a lot of, you got a lot of reasons. And what has not happened to me that I never thought it was going to happen to me? But like I told you, you learn from it. Nobody expects something to happen to you. In my life, I ran because of domestic violence. I left my father in Texas. I haven't seen for 3 years because I was gonna go, and last year I couldn't fit into dialysis. Um, I got a child that got molested. I have gone through everything in the book, but sometimes they say, "Don't you think of living this world?" I said, "Yes." I said it has crossed my mind sometimes to give up and do something stupid, but then I say, "What am I gonna gain? What am I gonna lose?" The only thing that people that do that, they don't think of the out outcoming, because sometimes you say, well, I'm going to die so I could make life simple or whatever. But when you take that choice, is you're living a hardship to your kids, if you have some, to your family, a financial and stuff like that, and you're still going to get missed, and you didn't resolve nothing. So my answer to those thoughts, sometimes I say, is just a week of sign that everybody goes through that. I think everybody goes
Absolutely.
through that little moment, but it depends on how you're going to deal with it, you know?
Absolutely. And I truly believe that, because everybody has a purpose here. God made no mistakes. And
Yeah.
who would have thought that on this day, December the 16th, 2018, that we would be having this conversation? Last year, you wouldn't have known or I wouldn't have known that we would be here today
No.
having this conversation. So there's a reason for this. I mean,
Yes.
I don't know what it is, but I know what my passion is about spreading awareness for kidney disease.
Yeah.
And you know, trust me, it's you do have a purpose. You do have a purpose, and I know that that third kidney will come. And you know, you know, it, I don't know. I'm just kind of speechless because I'm sure you're probably frustrated with the process. But being that all that the story that you shared, you are a very strong woman, and there are many, many other people that share that same journey
Yes.
that may not even speak about it, that's dealing with kidney disease. So that's why I commend you on sharing your story and being forthright and
Yes.
open because you truly are helping someone right now and you don't even know it. I don't
Yes.
even know it. I mean, and that's why I believe we're here this day, this moment, at this time to
Yes.
talk and share this information.
Yes. And it's not for nothing. About a year ago, I started. I had contacted the kidney bus, and I told them that I needed to see how could I get into the living donor announcements and stuff like that. And the persons that answered me, they told me, well, uh, we'll get in touch with you and we'll try to help you and make a website. And I said, okay, fine. But they never got back to me or nothing. So, but I was looking for a website to get advertising, and then I would tell my grandkids, do you guys know how to do these things and stuff like that? No, grandma, we don't. And
Are you there?
I'm gonna point to one of these persons here on Facebook and call them, send them a message and tell them how could you get into that, or and that you're willing to pay or whatever. So apparently she pointed to Jeffrey's name. So I asked Jeffrey and I told Jeffrey, how do you guys do this websites? I'm willing to pay you if you help me and stuff like that. But then he smiled at me. And then from there, I got to meet Jared, and since then they've been my little angels. They're my angels to
Absolutely.
me.
And you
Yep.
you beat me to the punchline because I was going to ask you how did you meet both of them, and you just told the
Yeah.
story. But let me say this: those websites, I know a person who, well, I know a person who is a donor who wants to be a donor
Uh huh.
that um, signed up for one of these websites that pairs you with a kidney donor. But the
Uh huh.
person who's looking for the kidney has to pay, the website, and the person who wants to donate is free for them. So, I mean, there is a charge with those type of services. Um, but I guess with Jared and his brother Jeffrey, you know that's a good pair because these guys are always on Facebook advertising. I remember when they first started when it was just advertising for
His
uh,
wife.
yeah, his wife,
Yeah.
and then it kind of snowballed from there. So I definitely appreciate those guys coming into something unknowingly, uh, other than through what their relatives was dealing with, and to
Yes.
research more and to turn something in that started out with their wives to I mean with their wife and sister-in-law to helping other people. So that is very commendable of them.
Yeah.
Absolutely.
Yeah. They do
So
help a lot, and to me, they're my angels because I was asking how and how, and I his workers. And we don't know nothing about it, but they know something's there, but they don't want to say nothing. It's like right now that I'm coming to home dialysis. It's less strict to come home now than before because in 1990 I went into dialysis, but I don't know, before when you would go into dialysis, you wouldn't have so many dialysis centers. So you had to go to the main hospitals. So when I started dialysis, my caseworker found me somebody that was trained to do dialysis, and they would get paid through the state and go to my house. So I did dialysis in 1990 at home, but somehow the state and everything would get paid. Now it's like you just find your relative or somebody to keep you at home. So I don't know how come so many patients haven't chosen to go home when you could find a caregiver that would be staying there with you, because some people have caregiver just to keep an eye on them while the wife or husband goes to work or something, and they could be observant and know how to train.
Mm-hmm.
But because right
Well,
now
well
it's no
now,
restriction.
right. Well, now you don't need a caregiver.
Yeah,
Medicare came out with a ruling that you can do it at home by yourself now.
yeah, so it's weird that so many people prefer to go to the clinics and deal with them instead
Well,
of.
that's true. I feel the same way as do a lot of people, but I've asked people that I thought were great candidates to do it at home, and
Uh-huh.
they just didn't want to be bothered with all the equipment and the ordering and just that whole logistical aspect of doing it at home, and also exposing maybe their loved ones to that, keeping it away from the family in a separate type of
Yeah,
containment where, they go and get their treatment and leave it there and, come home and, interact with your family and not even think about, um, you know, dialysis or anything like that. And
yes,
some people just they want to get their services. I've heard patients say, "I'd rather come here and let y'all do everything," meaning the staff
yeah,
doing the treatment. And then you have people, um, Jesusa, that live in urban areas that live in quote quote projects,
yes,
and they just don't have the space and the means, the resources, and all the other aspects it would take to do it. So it's
yeah,
so many different
things.
reasons and varieties and different angles to this disease. Is That's why we're just trying to put that message out there, because it just affects so
Yeah,
many people in so many ways, not just from being diagnosed at stage 1 and going through that whole process, but even having it and getting the transplant and just trying to navigate, you know, through that whole system where whether it's, transportation, whether it's get your medicine
yes,
or, it's just so much, but just something that just came to me. And I'm sure as Joe Bueno of Transplant Warrior, he shared this same story. He said that he'd been called maybe 6 or 7 times, you know, but you mentioned that you were called 9 times so far
yes, nine
for a
times,
kidney.
9 times.
I
And
mean,
I told Nancy, I said, how come you don't call me like when I got my second transplant? I said, when you call me the second transplant, they let me know Um, at that time, they would give you pagers, but like they never called me. That day, I left the pager. I don't know where, but they called me, and the sheriff would come and tell you, or the police will come and knock at your door, and
Why,
then
wait a minute, hold on. You saying if you was getting a kidney, the police come and knock on your door?
yes, they do.
Wow. I
Yeah.
mean, I never heard that before. I mean, I hear in Baltimore, if you get called from John Hopkins, ain't nobody gonna come knock on your door. If
Oh
you miss
yeah.
that call, if you miss that call, they're going right down the list. So you never know. Somebody could
No.
be in the bathtub. Somebody
Yeah.
could be somewhere and not had a pager or whatever, missed the call, and they give you so much time to call back. And if you don't, they go to the
Then
next
yeah.
person.
Yeah, they go to the second person, and at that time, when you had the pager, if you wouldn't answer it, they will send an officer to your house.
Wow.
Yeah, they would
That's
send an officer. Yeah, and then one time when I was taking my the pharmacy didn't have one of the medicines from the rejection medicines that I would take. So the hospital didn't have them either locally. So one time it was winter time and Spokane had them, but what they did was that they got the package to one of the state patrols in Spokane, and then the other state patrol met the other one in Ridgeville, and then gave it to the officer in Ridgeville, and then Ridgeville went to Canal and gave it to another one in Canal, and then from Canal, a Pasco officer came and picked up the medicine and delivered it to me within that day for
wow.
a medication that wasn't
Wow.
available in the hospital. But I have experienced that
Wow. I
the
mean,
troopers brought me the medicine. Yeah,
that's an incredible story. Do you
yeah,
know that? I mean, seriously. I mean, wow. You
yeah,
had like a multi-state police agency
yes,
transport your
medicine.
rejection medicine.
Yes, because they didn't have it locally here, and it had to come from Spokane.
I mean, you have some people who may have to wait for that. There's no,
Oh no.
especially in the urban cities. I mean, wow. That's wow. That's special. That's
Yeah.
special.
Yeah, I have experienced that. Um, so, and I have experienced within all these 9 calls, the seventh call, I did not answer the phone. I don't know what I was doing or something. I wasn't near my phone and I did not answer the phone. And the system, instead of calling my boyfriend, they didn't call me. They called my brother. They called the fourth one on the list. They called my brother. And until right now, I'm pissed off at him because this was a kidney that was matched to me. But the reason that I didn't get it was that they called him and he was the fourth one online to be called. He's a manager from a store. He got the call. He talked to them and he didn't make 5 minutes time to call me and say, you have to go to Spokane and get a kidney. Well, the time passed that they didn't call my boyfriend until 2 days later and me. And they said, we call you, we missed your call. We gave the kidney to somebody else.
Mm.
And that I'm still mad at my brother because I told him, you got the call and you're a manager from a store and you couldn't get 3 minutes to call me and or one of my girls and tell me somebody's calling you from Spokane, you get to go over there. And trust me, I don't talk to him no more or something, but that was one on the
Mm.
list.
I am
And the
so
other ones,
sorry.
and the other ones, I don't know, but the first one, I still remember all of them. The first one was from a person that overdosed. I didn't take it as my choice because I don't know how he ended up in a donor. Uh, he had an overdose. He was a 10-year user. How
Mm.
did he get that kidney and the transplant list? I don't know. I just rejected. The second one, It was on my birthday. Uh, it
Mm,
was from somebody that had a car accident, but they called me back and they said you didn't get it. You were a standby. And then the third one happened the same thing. I was a standby. And then the number eight, I went to Spokane. I got the call on dialysis. I left from dialysis and we went to Spokane. We did blood work and everything. The coincidence, it was so crazy because the second person that was waiting for the kidney was Mendoza. It was another Mendoza, and I met that person there. And then it was me, and we did labs and everything, and they told me go back to Pasco, and I'm gonna call you at 5 o'clock in the morning so you could come to the hospital. But then they called me and they said, no, we gave it up already. We gave it to the other ones, so you're not gonna get it. So number nine comes in and they say you are not on a standby. You're on top of the first one. Everything's gonna happen fast. So get ready. In 30 minutes we'll call you back. But apparently they called me back and they said that Dr. Yooho tested the kidney and it wasn't good. So now I'm waiting for number 10 and I always call them every month. I always call them every month and every month. They don't give me too much information because I told them I need to know if you're sending packages out or not. Have people called in and they just told me we can't give you that information or nothing. And I said, are
right.
you sure that when they call, you guys send them the packages right away? And they said yes. But apparently I cannot get a yes or a no from them if they have sent or if people are testing or something.
Mm-hmm.
Um, I just know that some people have come forward, but I know the first thing that they always tell us, if it's a living donor, you cannot pressure them, you cannot obligate them to go testing because they could change their minds and they have to go through the process of
Mm-hmm.
their willingness. And I understand that because um, when in 1989 I had lost the baby, and then the condition that I could go into the transplant list was um, that I had to tie my tubes. I had to tie my tubes. I'm not having no more babies. Um, the doctor. It took me a while because it's a process that I wasn't willingly to tie my tubes, but the doctor told me, and I still say it to myself, and I even say it to my girls. It made sense to what he told me. He says, Jessica, I'm gonna tell you something that some women don't understand, and it doesn't mean the race, it doesn't mean the color of the person or how it is, but in your situation, I know you're not legally married, you got a divorce, you got a domestic violence, but I'm going to tell you one thing. A baby is not going to resolve your happiness, it's not going to have you a partner, it's not going to have you a marriage. A baby is not the key for none of those answers. When a baby comes, is because God is going to send it and it's going to come for a reason. So your reason is that you're not the problem or nothing, but you have to tie your shoes and think about yourself. And I listened to what the doctor said and everything, and he says a baby's not gonna keep a man in your side or nothing. So I know it's a hardship and it's something that belongs to a woman's choice, but I understood it and I pray for it and everything. And I tie my tubes and everything, and that has always kept in my mind that I told my girls, a child sometimes is not the answer to keep somebody. It's it's a person's mind. It's a heart person to keep somebody next to
Absolutely.
you. Yeah.
Absolutely. Wow. So I'm sure your grandkids and your family are your biggest support system.
All of them are my support system. I just know that my reason here still for a purpose is trying to get the family together. We have little problems that daughters sisters get into a fight, they don't talk to each other and stuff like that. And I think my family is not for that. But my family has kind of deal with it, that they get into an argument and forgiveness doesn't come to it. And I never taught them and I never teach them that forgiveness has to come whether you do something right, wrong, or whatever. You always have to stay together.
Hmm.
And
So,
apparently my daughters and my son don't see it that way. And that's
mm,
the struggle that I have. All of them love me very much and everything, and my world is to my oldest one. But me and her have strained a little bit further, and she's the one that makes me hurt more inside.
mm, mm.
But
Do
that,
you still have the transplanted kidneys from your other two transplants, or did they
um,
remove the kidney?
no, they removed them. Yeah,
Okay,
they removed
okay.
them. Yeah.
And so they said that you're able to get a third one, no problems.
No, they said that I could get the other ones, but it was taking a little bit longer because of the antibodies that you have in your body. But
Mm-hmm.
yeah, but apparently I'm still waiting for one, and they have a place to it. I know that they did special scanning and stuff of my body because, like, I already had two transplants. They were figuring out where to put the third one. So I know that the doctor found a place. He didn't tell me where, but he says we already found a place when the time comes in, and that's where we're gonna put it, and from there we'll take it on. But I have had so many operations. Like, I have
Mm-hmm.
had two fistulas. If this fistula would give it up or something, I wouldn't have a piece of arms no more to give. So
Wait a
my
minute.
body's kind
How
of
many?
scarred.
So you have had access in your both lower and upper arms.
I have had the first one was on my lower arm on my left side, and then the second one was on my upper, from my shoulder up to the to the arm, the second one, and then the third one is in my right side, and it's long, and that's the one that they're using now. But I have had this year when I went into the second time, I had done two PDs operations. The second one didn't work no more. So the first one I tried it 2 years too. So in and out operations, and then the transplant removal, two removals, two transplants, and then I had two C-sections, and then that's about it that I know of. So I have had lots of them.
Wow. I mean, Miss Mendoza, I truly applaud you. Seriously. I mean, you are really a tough cookie,
Yeah.
and God is not finished with you. I I mean, just everything that you share with me. I mean, I know people who went through you know less than that, then didn't really survive. And to hear your whole story from you um, surviving domestic abuse to doing dialysis in your car on your break to, two-time transplant recipient
Yeah.
and the multiple calls, I mean, really, I truly applaud you and thank you for taking the time to really sharing your story. I mean, wow.
and
Wow.
and and God has gone into the operation rooms, because I one of my doctors, I don't remember the incident. I just remember that he told me, Jessica, I think it's that when I had the stroke. But he told me, Jessica, I don't know how we did this operation or what. You gave signs of you were not making it. We were struggling to keep you, but there was a light there. There was a light there with us, and God helped us through it. And when a doctor comes and tells you that, that means that God is there doing the surgery with him.
Mhm.
And
Mhm.
when a doctor tells you that, it's a big deal because you know that God is there. I know God has a purpose. Sometimes you do not understand the purpose, but I'm kind of thinking that the purpose is that my all my kids have to get along and they have to combine because I have told my kids, and it's a hard decision because I have never heard nobody say or write down in a funeral statement, you are not going to come and bury me. And I have told my kids, you don't come and look for me. You don't come. I don't care what I have done or what you have done to me or whatever. You're still my kids, and you have to forgive and you have to get acquainted with us, and we still have to work it out. But I have told my kids, if you don't look for me right now that I'm leaving, you're not gonna be burying me. And
Mm.
and one of my son-in-laws told me you can't do that. I said yes, I have a choice to do it. I said because if she couldn't forgive me when I was alive and couldn't come and see me and tell me, you know what, I'm too busy of a life to go and see you, that's just an excuse. And
Mm.
God has made miracles with me. My last baby weighed 1.5 pounds, and I was
Mm.
living in Texas. Maria, and Maria, it was happening the same thing. My baby wanted to come, so I was 4 months and a half, and I went into labor, and my baby decided to come early, and the doctor told me, "You're not gonna see a baby." And I said, "Okay." I said, you don't have faith." I said, as long as you have faith and I have faith, that baby's gonna make it. My baby weighed 1.5 pounds,
Mm.
and she survived. She's right now 29 years old. She has two beautiful grandkids. I have two beautiful grandkids,
Oh man,
and
God bless you.
and at 10 days of giving birth to her, she had an operation to drain her lungs, and they transferred to Corpus Christi, and she survived. She was there, born. A baby boy was there 3 weeks before she came into the world. She left before that little baby boy,
Mhm.
and
Wow.
she's kicking it and everything, and she's going through her stuff too. But she has shown what I have, what I have teached her. Um, when I came here to Washington, I moved because of domestic violence. So I didn't have family or nothing, only my kids now. But my mom was very strict and everything. She teaches us how to work, how to survive, and my family used to make Mexican candies, and my mom would always teach us how to learn from them in the kitchen. So I learned how to make Mexican candies, and when I came here, I was looking for a place to stay, and I made candies and everything. We sold them and everything, and that's how I got my apartment the first time. And I remember Maria a couple of years back, she wanted to pay for a college course. And she says, Mom, I need money. I said, well, I don't got money, sweetheart, to lend you or nothing. I said, but the only thing I could do is make you some batches of candies and you go and sell them. So yeah, she went to sell the candies and she learned how to make candies. So when she's in a hurry buying, she makes candies or tamales and she goes and sells them and gets the money for the rent or whatever. But she knows how
Wow.
to do that stuff. And my granddaughter that turned out today's birthday, she's 19 years old. She learned how to do Mexican candies. So she's the other
Oh,
one that knows how to do them. And,
wow.
you know,
So
they sell.
that's great. Absolutely. So we're coming down to the end of the show, but what I wanted to ask you, you've been through such a whole lot. I mean, you are
Yeah.
absolutely to be commended on your fortitude and your strength. What would you suggest to someone who's watching right now who been diagnosed with kidney disease and they're struggling to try to accept it and deal with it. They just started dialysis. Could you give them any words of encouragement from your experience of what you've been through?
When you become a dialysis person, it's very hard to adapt to it. And you're in the struggle, my life is going to end and stuff like that. But not really, because we do have a source to be alive. We could dialyze and keep going. The only thing that you have to learn is that you have to accept it. And when you accept it, you have to realize that it's a purpose for you to accept it and look forward on working through it. Because what you're going to learn is that by doing that, you're giving up on that pressure. You're not going to say, oh, should I or not. No, if God has given you this disease is for a purpose, you accept it and look for it, that it's going to be a testimony for somebody else.
Wow,
That's
that's
the way
powerful.
you have to accept. That's the way you have to accept it. Because at the beginning, I would didn't know. I said, "What is this? What do you have to do?" and stuff like that. And it's very hard. And sometimes this is another question that I was trying to get it out in there, but it's kind of awkward question, a question or a thing.
Mhm.
When when you come into dialysis, you could be married, you could be in a long relationship or whatever. And sometimes when you're on dialysis, if it's a woman or a man, sometimes you have combinations that you cannot serve as a person or a man in your relationship. And sometimes your other partner doesn't want to accept you and support you. But I could tell you one thing that I have learned. If that person is not right for you and doesn't want to help you in your bowels, that says in the sickness or in the health, that means that person is not right for you. And just let it be and let God be the ones to help you out. Because I have gone through that one too. And I have decided to say, you know what, I'm not going to worry about you. If you cannot be here in the picture with me as a partner or my husband or my wife, go ahead and leave. But I know that God has a purpose and somebody else better than that person for you.
Wow, wow,
Because
powerful.
some marriages cope with that, and I have coped with that too.
Absolutely. A lot of people are dealing with that situation. And
Yes,
I think we may do a show on that intimacy, relationships, and kidney disease because,
yes, it does
um,
happen.
yeah,
It
yeah,
does
it,
happen.
it
Yeah.
does. So, anybody you want to say hello to before we leave?
Well, I say hi to Jeffrey and Jared, and you're my little angels, and I owe everything to you guys. And maybe once in life we'll meet. But my prayers are with everybody, even with you, Steve, and all the people that are praying for me and helping me. I love you guys, and I bless every moment of your time on me. And I
Thank you,
love
Ms.
you for that.
Mendoza. I appreciate you. I appreciate that. I appreciate you even taking the time and sharing your story, which is a very, very inspiring story. And I hope and I know it will help someone watching tonight.
Yes.
And, I look forward to, seeing more of your posts on, Facebook and reconnecting with you, possibly on a
Okay.
future show, bring you back on
Okay.
another show called Sisters Against Kidney Disease with host Sherelle. That's on Tuesday nights from 9 p.m. to 9:30 p.m. Eastern
Okay.
Standard Time. So it would be 6 to 6:30
And
your
my
time.
time.
So,
Mhm.
yeah, you. I mean, God bless you because I mean you just have a inspiring story, and
Yeah.
I'm definitely going to keep you in prayer that you definitely get that call that you're
Yes.
waiting for. All right. So I'll be
I'll
talking
see
to
you,
you soon,
Steve.
Miss Mendoza.
Okay,
God
bye,
bless you and
Steve.
take care.
Okay, bye bye. Love you
All
guys.
right, all right, all right,
Bye.
all right. So, guys, yeah, definitely like to thank Mrs. Mendoza for coming on and sharing the story with us. Really, really inspiring. Um, this Tuesday from 8 to 9 p.m., I'm going to have a special guest on, Courtney Brown from Washington, D.C., from my hometown, D.C. So that's going to be on Smashing Kidney Disease Tuesday, December the 18th from 8 p.m. to 9 p.m. Recent transplant recipient warrior Courtney Brown right here on Smashing Kidney Disease. You can see that on our Urban Health Outreach Media page. Again, thanks for watching this late night edition of Sunday Morning Transplant Coffee Talk. I am your host, Steve Belcher. Talk to you soon. Peace.